Simplified methods for modeling dependent parameters in health economic evaluations, a tutorial. This presentation is based on our publication in the Applied Health Economics and Health Policy. The SARS and R code for the examples can be found in the appendices of this article. Author contributions for this article. I thank my co-authors. The outline of this presentation. I will start with the background. In health economic evaluation, model parameters are often dependent on other model parameters. For example, family doctor visits and specialist visits may be correlated, and the costs of physician visits are typically correlated with drug costs. Markov models are frequently used in health economic evaluations. When a Markov model involves two or more state transitions in a single cycle, from healthy to disease state and from healthy state to death, the transition probability between Markov states depends on other competing transition probabilities. Ignoring correlations or dependence between model inputs may result in inaccurate estimates, both expectation and variance of model outputs, of cost and effectiveness in health economic evaluations. Compared with modeling with independent parameters, modeling dependent parameters is technically complex. More importantly, the correlations between model parameters are frequently unavailable for model-based health economic evaluations, because published studies often do not report the correlations between variables, the potential model inputs. For these reasons, most applied health economic modeling studies do not incorporate the correlation or dependence of model parameters. This tutorial introduces relevant statistical concepts and proposes simplified approaches using published data to handle dependent parameters in typical scenarios encountered in health economic modeling. Compared with existing methods, these new approaches are easier to implement for health economic modelers. This article addresses three areas of modeling dependent parameters. 1. Estimating the unreported correlations from summary statistics. 2. Implementing a univariate normal distribution from multiple regression coefficients. And 3. Applying a conditional probability method to handle competing risks in a Markov model. I will present estimating the unreported correlations from summary statistics. This flowchart that outlined the context and the proposed simplified method. Correlation and covariance are basic measures of the linear relationship between two variables. In this section, methods are illustrated for quantifying the covariance and the correlation coefficients of correlated variables based on published summary statistics. We also provided an introduction to how to generate multivariate normal distribution data, a generalization of the one-dimensional normal distribution to higher dimensions, along with three examples: diagnostic accuracy, physician visits, and cost data with three components. In health economic evaluations, understanding parameter uncertainty is essential, which represents the uncertainty around the mean estimator. Based on the central limit theorem, the estimates of parameters, or transformed parameters, are often assumed to follow a normal distribution. When the estimates of parameters follow normal distributions, Pearson correlation coefficients are a suitable measure for the linear relationships between these variables. Therefore, multivariate normal distribution data is the focus of this section. The simulation of correlated data using Excel is relatively complex, but SARS and R offer user-friendly solutions for simulating multivariate normal distribution data. The syntax of simulating multivariate normal distribution data is presented in this slide. Basically, we need to provide the means of variables and the covariance matrix. After the data have been generated, The SARS dataset can be exported to a CSV file for use in other applications. Excel and TreeAge are the most commonly used software packages for decision analytic modeling. Excel users can use the index function to reference the multivariate normal distribution data for each simulation. TreeAge users can use the table function and the reserved keyword _sample, the index for the iteration being processed in the probabilistic analysis loop, to reference the multivariate normal distribution data in probabilistic analysis. Example 1 was to simulate the correlated diagnostic accuracy data based on a meta-analysis. The authors reported that the logit sensitivity was 3.55, the logit 1 minus specificity was -1.01, and the correlation coefficient was 0.64. We listed the steps for generating correlated data using the rand_normal function. This slide showed the summary statistics of simulated data, which were consistent with the parameters used to generate the data. Example 2 was used to illustrate the approach to estimate correlation coefficient of parameters. Formulae for expectation and variance for the sum of linear combinations of two random variables were presented in the slides. Healthcare service data are often correlated, but the correlation coefficients frequently go unreported in publications. In the current example, the sum of the squared standard errors for family doctor visits and specialist visits was smaller than the squared standard error for total physician visits, suggested that family doctor visits and specialist visits were correlated. Using formula above, we calculated that the covariance of family doctor visits and specialist visits was 0.00045. We further calculated that the correlation coefficient was 0.29. We then simulated the correlated data for family doctor visits and specialist visits. After incorporating the correlation, the mean and standard error for total physician visits, calculated using the sum of the simulated family doctor visits and specialist visits, were same as those reported in the original article. If we simulated independent distributions for family doctor visits and specialist visits, we would underestimate the variance in total physician visits. Example 3 was the simulation of various cost components to derive the total cost. In economic evaluations, instead of assigning a distribution to the total cost, we often prefer to assign distributions to the different components of cost parameters. In this way, we can understand how the different cost components contribute to the economic results. The squared standard error of the total medical costs was greater than the sum of the squared standard errors of hospital costs, physician costs, and prescription drug costs, suggesting that correlations existed among three cost components. There are three correlation coefficients in the correlation matrix. The magnitude of correlation affects only the variance of total cost. It does not affect the mean of total cost, or the mean and variance of each cost component. Because our main goal was to properly understand the variance in total costs, we assumed that the three correlations were equal. We presented the variance of linear combinations of n correlated random variables in equation 4. Under the assumption of a common correlation coefficient of three cost components, we derived the equation of the correlation coefficient. The calculated correlation coefficient was 0.334 for the three cost components. I will present using univariate normal distribution for linear predictors based on results from multiple regression models. Regression analysis is a statistical method to estimate the relationship between a dependent variable and one or more independent or explanatory variables. We provided justification for the equivalence of using univariate normal distribution instead of generating a set of explanatory variables, such as age, sex, disease severity for a regression model that includes a linear predictor. We also provided examples using parameters from a linear fixed effects model and a Cox proportional hazards regression model. This slide provided the details of the justification. We provided a summary in the next slide. One property of multivariate normal distribution is that the linear combination of multivariate normal distribution follows univariate normal distribution. See equation 9. Linear regression models, generalized linear models, and Cox proportional hazards models include the linear predictor of the outcome, given a set of values for the explanatory variables. We can assume that the estimated regression coefficients for linear predictors follow multivariate normal distribution. The values of these coefficients and the variance-covariance matrix can be obtained from the regression analysis. Let A1, A2, AP represent a set of values for the explanatory variables, such as patient's characteristics to capture heterogeneity. We are interested in knowing the distribution of linear predictor. We can directly calculate the mean and standard error of the linear predictor using the matrix products. Then, when we conduct probabilistic analysis, we can simply define the univariate normal distribution of the linear predictor to capture the patient's characteristics, instead of generating multivariate normal distribution data. Example 4. A United Kingdom study used a linear fixed effects model to evaluate the impact of diabetes complications on health utilities. The final EQ5D model included 12 explanatory variables. This article reported coefficients and the variance-covariance matrix of the linear fixed effects model in the main text and supplements, respectively. We defined a hypothetical patient with the values of these variables. We have summarized the steps of calculating the mean and standard error of the linear predictor via SARS-IML. Step 1. Import the coefficients and the variance-covariance matrix. Step 2. Input the values of the explanatory variables as a vector. And Step 3. Based on equation 9, calculate the mean utility value and the standard error of the linear predictor. Another property of multivariate normal distribution is a subset of multivariate normal distribution data also follows a multivariate normal distribution. We use the same method to obtain the distribution of the difference in utility between two hypothetical patients, given the differences in explanatory variables. When there is certainty about the order of utility values for two health states, for example, the utility value of one health state is always higher than the other, a gamma distribution can be defined to make the utility difference always positive. Example 5 was linear predictors in a Cox proportional hazard model. The Cox proportional hazard model includes a linear predictor. In the appendix of our article, we provided the details of the conventional method which generated the multivariate normal distribution data for the 5 coefficients to calculate log hazard ratio, and the new method to directly generate the univariate normal distribution of log hazard ratio. As showed in the plots, the distributions of hazard ratio of these two methods were same. Now, I will present conditional probability method for estimating transition probability in Markov models. In a Markov model, the probability of transitioning from one state to another is called transition probability. A conditional probability method is proposed for handling two or more state transitions in a single cycle in a Markov model along with two examples. Based on a clinical trial for patients with acute ischemic stroke, we developed a Markov model with 3 health states: functional dependence, functional independence, and death. Given the severity of the disease, we assume that all patients were functionally dependent at time 0. In the endovascular thrombectomy group in this trial, 44.6% patients were functionally independent, 41.3% patients were functionally dependent, and 14.1% patients had died at 90 days. When using the unadjusted method with equations 10 and 11 for the Markov model, we found that the model outputs were not consistent with the observed data. The unadjusted method is an inappropriate approach because of the multiple transitions that occur during a single Markov cycle. Previous researchers have noted this problem and proposed some methods to address it, such as proposing equations for competing events, estimating each transition rate for competing events using Kolmogorov's forward equations for transition rates, or performing eigendecomposition. But it is not always easy to implement these complex methods in practice. Here, we introduce a new approach, the conditional probability method, to estimate transition probabilities for multiple transitions in a single Markov cycle. This method can be used in both one-way and two-way transitions Markov models, examples 6 and 7, below. We provided the proofs of conditional probability given changing health states in a Markov model. We assume that all patients are at health state A0 at time 0, and all health states are mutually exclusive. Let us also assume that no patient-level data are available, and we know only the total number of patients at each health state at time t. We can calculate the sum of the probability to change health states at time t using equation 12. We can convert p-sum into the transition probability of any change of health state at a desired Markov cycle length, pm-sum. We can then express the transition probability of event I at the defined cycle length from the conditional probability method in a general form, equation 13. Let us divide time t into k Markov cycles. Running Markov model for k cycles and using the transition probabilities from equation 13 would result in the same probability of being at health state I at time t from the observed data. Example 6 for stroke patients illustrated of applying the conditional probability method in a one-way transitions Markov model. This method consists of 4 steps. Step 1. Estimate the total probability of transitions from a functional dependent state, all patients at this state at time 0, to other health states at 90 days. For mutually exclusive events, the probability of either event occurring is the sum of the probabilities of each occurring. In this case, the probability of changing health state over 90 days, p-sum, moving to functional independence or death, was equal to 0.587, 41 plus 13, divided by 92. Step 2. Use equation 10 and 11 to calculate the event rate and monthly probability of changing health state. The rate of changing health state was 3.54 per patient year, and the monthly transition probability was 0.255. Step 3. Calculate the conditional probability of functional independence and death, given the changing health state. The conditional probability of functional independence was 0.759, equals 41 divided by 41 plus 13, and the conditional probability of death was 0.241, equals 13 divided by 41 plus 13. Step 4. Calculate the monthly transition probability for Markov model. The monthly transition probability to functional independence was 0.255 times 0.759 equals 0.194, and the monthly transition probability to functional independence was 0.255 times 0.241 equals 0.061. We ran our Markov model using the monthly transition probabilities by the conditional probability method. The probabilities of stroke patients in functional independence, and death states from the Markov model at 3 months were same as those reported in the clinical trial. We also examined this method in a Markov model with 4 health states using the same example. We did not change the functional dependence and death states, but we did define no symptoms, MRS score 0, and minor symptoms, MRS scores 1 to 2. We ran the 4 health state model using the conditional probability method, and our results were consistent with the observed data. The conditional probability method was applied to more complex scenarios in example 7, allowing for two-way transitions from health to disease, and from disease to health, and for patients to be allocated to different health states at the beginning of Markov model. We assumed that a cohort of patients with stroke were assessed by physicians at 6 and 12 months post-stroke. Doctors categorized their health states in 4 health states at both visits: no symptoms, minor symptoms, functional dependence, and death. However, no information was available about patients' health states between 6 and 12 months post-stroke. As a result, we made the following assumptions related to transitions. 1. If a patient was in the same health state at both visits, we assumed that they did not change health state during the period between 6 and 12 months. And 2. If a patient was in different health states at the 2 visits, we assumed that they experienced just a single transition in this time period. Partially using the data from the Oxford Vascular Study for stroke and with some assumptions, we developed accounts of transitions matrix for a hypothetical cohort. The row total was the number of patients in each health state at 6 months post-stroke, and the column total was the number of patients in each health state at 12 months post-stroke. For example, of the 208 patients in the functional dependence state at 6 months, 144 patients remained in that health state, 5 transferred to no symptoms, 35 transferred to minor symptoms, and 24 died between 6 and 12 months post-stroke. Let us assume that transition rates are constant over 6 months, from 6 months to 12 months, for all transitions, and use monthly cycles for 6 cycles of the Markov model. We used the methods introduced above to estimate the total transition probabilities and conditional probabilities for patients at 3 surviving states, tables A13, A14, and A15. We ran the Markov model for 6 cycles and got the same results as those, column total, in table 4. We have illustrated the calculation process in Microsoft Excel. It should be noted that we needed to define the new states. No symptoms, minor symptoms, and functional dependence for patients who were transferred from other health states, given that these patients were not allowed to transfer to other health states under our assumption of up to 1 transition between 6 and 12 months. Now, I will provide the key points of this article. This tutorial proposes an extension of routinely used methods along with several examples. These simplified methods may be easily applied by health economic modelers with varied statistical backgrounds. Incorporation of correlations or dependence may improve the precision of cost-effectiveness estimates for decision-making. The timeline of this study. I conceived the ideas of conditional probability method in a Markov model and used this method in a cost-utility analysis for patients with acute ischemic stroke in 2015. Almost 10 years later, this article was published. The title of this article was changed a few times in revisions. Thank you.